Good evening. I'm so glad you're watching PBS Fort Wayne tonight. We have a very interesting show, a topic that you may not need right now, but perhaps at some time you will with your family or a friend. We're going to be talking about hospice this evening. And I have three people here that are very experienced and educated in the area of hospice. I would encourage you to give us a call here, 969-2720. You can see that number there on the bottom of the screen, and that'll be appearing frequently here in the next half hour. This is your chance to get some of those questions answered. I'd like for you to meet, although if you watch Life Ahead here, I almost said City Style 15. That was a show I did many years ago, but welcome to that as well. Okay, Life Ahead is the name of this show, and we call it that, by the way, because we have different topics each week, and we try to give you information and education in areas that you might need in your life ahead. Okay, so that's why we're doing a hospice here. Jesica Thorson, attorney,
yes,
right here. You've met her many times here on Life Ahead. And about a year ago, you were here, right, Dr. Petersen?
That's correct.
Okay.
Happy to be back.
This is Dr. Dustin Petersen, and you are a physician with hospice, basically.
Correct. I had to see patients in the capacity of hospice and also palliative medicine.
Okay, and then also working with hospice, we have Shandi Steele. Love your name.
Thank you. Thank you, Sandy.
Shandi,
Yes.
I like it, and that's with an I.
Correct.
Is that right? Okay, that's the difference there. And Shandi, what is your position with hospice?
So I'm a hospice care consultant.
Okay, a care consultant. Do you meet with the families then before somebody goes into hospice, or what are your duties?
I do meet with families, patients and their families to talk and provide education about hospice care and what we do and the services we provide. And then I also do community education, similar to this.
Oh, and this is community education.
Correct, yes.
All right. Certainly that's what tonight will be. Jesica, you have been on the board of hospice for how many years? A number of years, right?
Almost 9.
Wow. So very dedicated
Yes.
to the topic. Why did you choose to spend part of your life or energy with hospice?
Honestly, I really truly love hospice medicine because I think it's so important to have that kind of holistic care at end of life. And honestly, hospice nurses just have a special place in my heart. I mean, they just are just amazing individuals that provide really great care at a really difficult time in families' lives.
You know, we were talking, some of us in the break room before the show started, I think before you guys got here, about the values of hospice and that the people that volunteer or hospice caregivers are amazing and are a rare kind. I mean, it takes a special person, I think, to be in hospice. Dr. Petersen, you've probably worked with a lot of different volunteers and caregivers during hospice. What would you say are the criteria or characteristics that make somebody really good at it?
I think the biggest thing is just someone who enjoys being with other folks and spending time with them. I think that what a lot of patients and families appreciate, especially on that side, is being with someone who doesn't necessarily bring some particular stigma about end of life or some health problems, but somebody just to be there and experience time with them, to have some things to look forward to, somebody to visit, somebody to help them with, somebody to be a friend.
And then as a physician, what are your duties, or how often do you see a person that has been instigated into a hospice?
The physicians are very much so involved in patients' care once they come into hospice. A lot of our work tends to be a little bit more behind the scenes in working with coordinating with the nurses. There are weekly or bi-weekly, meetings where the entire team has representatives that come together to help come up with a care plan for patients. I will often see patients that are in an inpatient level of care, which is a very small proportion of our population of patients.
Care. All right, and we have a building here in Fort Wayne. Do we have one in every county?
It depends on the hospice agency. But every hospice agency, as part of their requirement to participate in a hospice program, has to have a plan and a facility in place for patients that are having an acute episode where their symptoms are being difficult to manage at home or wherever they might happen to be, where they can basically get the same level of nursing care and help from the physician as they would if they were admitted to a hospital.
Are they always, now, from what you've told me before, you serve, is it 9 counties, Sandra?
13 counties. So we cover 13 counties in Northeast
okay,
Indiana.
so all the way north to LaGrange, Steuben, all the way
All
up
the way
there?
up to Steuben, Noble, DeKalb, over to Kosciuszko, and then all the way down by Adams,
Wells and Adams and-
Jay,
okay.
Blackford, Grant.
Okay, a lot of areas. So each one of those counties then will have some sort of a separate agency within that county?
There's agencies available all over. Hospice itself is, and Shandi can probably talk better to this, is generally a Medicare program, and different insurances are going to have that benefit as well. But that's part of the key, I think, to like what I do as a physician between palliative medicine and hospice, is that hospice is, palliative medicine is a specialty, just like a cardiologist or a neurologist. But our specialty really, I like to say, our toolbox, we use medications and things too to help patients, but our toolbox really is time and communication.
Yeah.
And we are really there to sit and understand what's important to patients and how can we help them have the best time that they can, whether it's enduring whatever medical treatment they're having or close to the end of their life. Hospice itself really works together with palliative medicine as a program to bring resources to the patient, to their loved ones, to help care for them.
What do you do for the families? Shandi, I'll let you answer that one. You're, as a consultant and all of the responsibilities you have, you've met with a lot of clients and a lot of the families. So what is your job to the families, or your responsibility?
Sure, and I love that question, and it goes right along with what Dr. Petersen was saying. So when we talk about hospice care, what I really want your viewers and what I really want people to know about hospice care, it's a specialized team, so not just the physician, but you have a nurse, an
Team
aide,
is the key word.
a team. It's a specialized team, and they come in and they provide personalized care. So that's really what we're talking about. I want people to understand that hospice is it's a very specialized approach to care. So it's for someone who isn't focused on curing the illness, right? But caring for the person.
Yeah.
And so it's not giving up hope, it's redefining hope, having those goals of conversations.
Yeah.
What do you want this journey to look like? How can hospice come alongside you and support you through that journey?
So you would talk to the families about that as well. I mean,
Absolutely.
What are their expectations? What can you do for them?
Absolutely. And with that team is a nurse, an aide, social worker, non-denominational spiritual care counselors. We have hospice-trained volunteers. We have music therapy, massage therapy. There are a lot of disciplines on that team, that specialized care team that we talked about, that come alongside. So it's not just care and support for the patient, but also for the family. So hospice is a very holistic approach to care, right? We're not just talking about medications for the physical symptoms.
We're not just talking about pain management.
That's right.
Yeah.
It's not just about the physical symptoms, emotional, spiritual, all of those different things that come with an illness, again, for the patient and the caregivers and the family.
Shandi, I want to continue with you on this. As far as giving care to those patients and their needs, does every patient or client that you have that opportunity, have a complete team meet with them, or what? How does that work?
Every patient on hospice care has access to all of those team members if they choose. So they can choose to have a social worker, they can choose to have spiritual care, but you typically will always see your nurse and your aide. They're the core care team that are going to come in, manage your medications, help with daily activities of daily living, bathing and things like that.
Dr. Petersen, as far as medications or whatever, are these things that you prescribe for the patient or their family physician? How does that all work? And I know that sounds like a silly question, but I don't know the answer.
No. It's important, and some patients come with a very strong relationship with their physician.
Yeah.
And with most hospice agencies are going to respect that. They certainly don't need to, and most transition over to the hospice medical director. There's always a physician that's going to be on call 24/7, so no matter what the problem might come up, with a family, there's always someone they can get in touch with, and those nurses have a physician available if they need to change orders, if they need to call in medications, whatever they need to do to make sure that that patient and their family is supported.
Do you need to travel to all those counties for patients, or how does your job work?
There are members of the team that are going to travel. Most of the time, physicians are not going out to patients' homes or to nursing facilities, but they are always involved in all of those patients' care.
In making the decisions. Do you meet with the family before somebody's enrolled or signs up for hospice care?
On the clinical side, there are going to be folks both on Shandy's side and as well as on my side that would meet with a family. Part of that is she can speak to as far as what resources are available and how things work logistically. On my side, part of it is to make sure that we understand, first of all, does the patient qualify?
Yeah.
So they have to have a medical diagnosis that qualifies
let's
for hospice.
Make sure we state all that very clearly. All right, the question or the comments that Dr. Petersen's going to talk about are qualifications to be a hospice patient, yeah? Right. Okay, go ahead.
If I'm seeing a patient in the hospital, for instance, and patients can come to hospice without being in the hospital, but if I'm seeing a patient in the hospital, I'm often seeing them as a palliative medicine consult.
Okay.
Hospice may or may not be appropriate for them. If they have a diagnosis where it's normal course of playing out with that disease process is that we expect them to live no more than 6 months, then they would qualify for hospice as a benefit.
Is that the magic number, 6 months?
Correct. And that's something that's going to be reassessed on a basis. There's rules. That's part of that biweekly meeting is to talk about are all their needs being met. And on rare occasion, patients' prognosis improves. And patients can be discharged from hospice.
That was my question. I think that we talked about that when we talked about hospice last year, that if somebody improves during their hospice time or stay or whatever, then they can say, see ya, goodbye, and then, leave and come back later if they need. Okay, does that happen very often?
It's not very common, but it does happen on occasion.
Okay, so it's not like you're committed totally.
Correct. And patients and families also have a choice of their own to revoke.
Sure.
If they either are not happy for some reason with the agency, I'm sure every agency that I would be aware of would encourage them to talk about their concerns to try and address them. But folks do sometimes change agencies or do decide that hospice, for whatever reason, is not right for them.
Okay.
Again, not very common. I think most people are feel very supported.
Shandy wants to say something, I can tell.
Yes, because I think we're on such a good part of the topic, right? Because I think that 6 months or less is scary. And I think that's the stigma that challenges us when we're talking about hospice care. It's part of the reason that people are afraid to talk about hospice care. And I just want, again, people to know that 6 months or less, that's the verbiage that we have to use, right? But no one sitting here and no one that I'm aware of knows that when you're going to pass away. No one knows if that's truly in 6 months or less. That's just saying if your illness takes its normal progression, you could pass in 6 months or less. But to Dr. Petersen's point,
is it their doctor that makes that?
It's the physician that makes that decision, correct?
Your decision or their family physician?
The hospice, a family physician may refer someone or suggest that they look into hospice based on that, but the hospice physician is the one that's going to certify their illness to participate in hospice.
What if there are people out here watching that maybe with their family again or friends, whatever, that somebody's very, very ill and they think hospice would be appropriate, but their family doctor hasn't told them that or they don't have one? Can they contact hospice directly?
Yep.
Yeah?
Yes, they sure can.
Okay, all right, good. And if they do, we have our legal expert here. Jessica, what kind of legal documents do you have or should have in place if you're going to consider hospice?
The most important one is some sort of advance directive and appointment of a healthcare representative.
Yeah.
This is somebody to be your voice in this journey when you cannot express your wishes anymore. And so the advance directive piece of it is where you really do have the ability to spell out what maybe some of that care plan looks like. very detailed or very just kind of broad desires that you want, what comfort looks like to you. And so that not only helps the team know what you want, but it also reassures your family that they are making the right decisions, that they're advocating appropriately for you.
Right. Again, personalized care, I guess.
Yes.
You know, I mean, the family could, you know, talk to Shandi or Dr. Petersen and say, you know, my mom loves music. That would be a good thing for her.
Yes.
Don't read to her. She doesn't like that, you know, or whatever. But they can maybe give you some input.
Yeah.
As to what might be appropriate. Okay, legal documents. How about power of attorney, all those things that we always talk about?
Yes. So a durable power of attorney is going to be something that is going to help your family make financial or business decisions for you. So oftentimes when you are on hospice, you may be at home, you may not be at home. And so figuring out how you're going to provide for the other care that you're receiving, whether that's some sort of rent, room and board, things of that nature, the family needs to be prepared on how to handle that. And so a durable power of attorney is going to allow them to do those decisions and make those decisions for you. Then, of course, either some sort of last will and testament or maybe a trust, depending on the circumstances, to handle your affairs for when you are gone. Who's going to make those decisions, or at least handle those type of things? Where are we going to sell these things right away? Are we going to donate?
Decisions,
all of those things.
Yeah.
And of course, the more you communicate with your family about what you want to happen with your possessions, the better. But some sort of will or trust in place so that people know where you want your possessions to go when you pass.
That's a tough one. I want to talk about that just a moment here. I think older generations are much more private than people are right now, and they don't even like to share often. Maybe I'm just assuming this, but from what I've, people I've met and things I've heard, they don't really like to even share their financial situation with their own children. Or they are just not comfortable talking about, what are you going to do with my things, or here's the nursing home I want to go to, or they just don't talk about it. What's a good way to get them to open up and share that information, Jesica?
So you really start a conversation, really just tell me about your family and the dynamics of your family. And generally speaking, if I can get a family talking about those type of things, we can maybe start talking about some big picture things of what is it that you want? What are you comfortable with? Having somebody come into your home or going to an assisted living. Because believe it or not, some people don't want somebody in their home. They would feel more comfortable going to an assisted living. So sometimes just starting a general conversation about the dynamics of your family and who helps with this and who helps with that, even if it's talking about Thanksgiving dinner. Those things kind of get the ball rolling. And then we really start trying to narrow down from there of what does care look like to you, what type of medical treatment is appropriate. I mean, sometimes we try to get very specific, sometimes we just have to refer them to you all because you have better words than even I do. I'm usually dealing a lot with the dynamics, making sure that the family is going to be working together to support and advocate for this person.
All right. She just endorsed you, Dr. Petersen.
I think that's very similar advice to what I would give. The piece that I usually say when it gets difficult to think about, do I want CPR, for instance, and folks don't want to talk to the, or a lot of times a patient may want to talk about those things, but their family member doesn't want to hear it. And so the advice I give usually is, what brings you joy? What is quality of life for you? What are the things that you look forward to when you get up during the day? Because those are the things, when they really understand that about you, when they hear that about you, when they're sitting down in an unfortunate circumstance and you can't speak for yourself and they're talking with a team of physicians or a medical team, those are the things that they can say, well, will they be able to do these things again? Or what types of treatments are we looking at to have a chance to be able to recover to that point? That really helps them, I think, to make the best decisions for that loved one. Is thinking about the outcomes. Are those outcomes likely? Are those outcomes acceptable to someone? Rather than the medical treatments that nobody else really is an expert in. And as conditions change, those treatments, the outcomes are
That's why
change.
they have you. Shandi, what about your experiences with clients? what are some of, funny question here, but I am curious. What are some of the most unusual things that patients request or the family requests for them, or what are the most common things?
Sure. So, well, if you want to know, I mean, unusual,
Yeah.
unusual for hospice is probably every single day.
Oh, really?
Yes, I would think so, yeah. Because every family is different, every patient is different, but it goes right back to that personalized care. Because you're having everyone come in from, if it's me meeting with them for the first time or someone on our team meeting with them for the first time,
Yeah.
just to provide information, right, to talk about hospice and provide information. And it's just what Jessica said, you do more listening than talking. Tell me about yourself, tell me about your family. That's when those things will come out,
Yeah.
and then you can provide the best plan of care specifically for that patient and family, including the quirky things or not, yeah.
Yeah.
What about volunteers that help with hospice and go and be with the patient or the client? What do you require, or if you're interviewing people that want to come and help, what would you look for? What characteristics?
So our volunteers, they actually go through the same training that our
Oh, do they?
employees do. They do, and we're very fortunate. We have a robust volunteer group at where we're at with our hospice agency, so we're very fortunate about that. Hospice volunteers, it's a requirement as part of that program. So
Oh, it
every
is. Okay,
hospice
so you will
agency-
train them, in other words.
Correct. Every hospice
Okay.
agency has to have volunteers, and they get trained. They're trained through the same program typically as the employees would be, and they provide so much additional support to patients and families. They can go in, because they don't provide direct patient care, they can go in and really focus on those
Just
things
be with them.
that bring that joy, right? That they maybe can't do for themselves anymore, but that the volunteer can help them do, whether it's reading, maybe sewing, all types of things that volunteers can help do, and really, really focus on quality of life.
Do
It's wonderful.
most people want somebody to be with them much of the time, or not?
I do think that a lot of our patients, I mean, again, I would say that's different for every case, but most patients and families really enjoy once you get to know your team, because the hospice team should be generally the same people. You should be seeing the same people, and you just get to know them. They often become like family. And so, yeah, I think that most of the time people really enjoy having their care team come visit them and see them.
Jessica, aside from the legal questions, I ask you, you've had so much experience here with all these years with hospice. Anything to add with what Shandi was saying in terms of what it takes to be a caregiver?
It's of course it's patience, but at the same time it's just listening. It's really truly listening to what it is that individual wants, so that you can be their voice and advocate for it. I think everybody's a little bit different as whether they want, pets there, or if they want music therapy or things of that nature. But they really do want somebody that they can trust to really truly be their voice. And so I always say, plan early, have these conversations, even if it's very broad conversations, try to plan early as much as possible, because then you know that this person is really going to speak for you, and get the things that are going to bring you joy, that are still going to give you quality of life and be with you through the end.
Well, it may be harder for the family sometimes to be with you, there toward the last months or weeks, because of the emotions involved, and maybe an outside person that comes in as a caregiver might be able to supply that more easily, I guess, or with less emotion. We're down to just almost about a minute left here, Jessica. How would people contact hospice if they want to volunteer or get involved?
So generally I would recommend you find a hospice agency that you're comfortable with, and then contact them. Most of them will have a direct line to kind of sign up to volunteer for them and walk you through the process of being trained and going through that process.
Okay.
And I'll add to that, Sandy,
Sure.
that it's really important that everyone knows that you have a choice. So there's always a choice, and we encourage people all the time to interview hospice agencies, just to make sure that you're getting that right fit for you and your family.
What do you mean they have a choice? Do you mean in which agency, or
Yes,
what they do?
absolutely. In which agency you choose, you always have a choice. Patients have the right to
Okay.
choose who they're going to receive their care from, whether that's the physician, a hospice agency, whatever you're talking about. Patients always have the right to choose.
You know, one of the reasons, maybe the main reason we're talking about this tonight, is that November is National Hospice Month.
Yes.
So you may be hearing about it from a lot of different sources here in the next couple of weeks. Meanwhile, I'm glad you were with us tonight here as we talk about this topic here on Life Ahead. And you know, every Wednesday at 7:30, right here on this set, we have another topic and other guests that will help you with your decisions and your life ahead. Meanwhile, you can watch this show again throughout the weekend. I think it airs 4 more times, or you can check onto YouTube, and that's where you can also watch this show or other Life Ahead episodes. Thank you all, Shandi, Dr. Petersen, and Jessica.
Thank
So
you
glad
for
you were
having
here
me.
with
Yeah.
us tonight.
Happy to be here.
Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Beers Mallers, elder law attorneys, providing information on legal matters of guardianship and financial issues relating to nursing home care. Beers Mallers attorneys can also assist with Medicaid requirements and help navigate difficult family situations. Beers Mallers, attorneys at law, with offices in Fort Wayne, LaGrange, and on the web at beersmallers.com.